This is Marco recording Katie, putting in or inserting an indwelling catheter.
So I come in. I'm going to review the patient's medical record, including healthcare provider's order and nurse's notes. I'm going to review any prior catheterization, patient's response to the catheter, the size of the catheter, and the time that the catheter was put into place. I'm also going to review medical record for any pathological conditions that may impair the passage of the catheter, including patient's gender, age, and allergies. I'm going to perform hand hygiene. Introduce myself. Hi, I'm Katie, student nurse from Montcalm Community College. May I have your name and date of birth, which is 2 patient identifiers, check the wristband, and then I'm going to compare it to the medical record. Do you have any allergies? And ask the patient their allergies. And then I'm going to assess patient's weight, level of consciousness, developmental level, ability to cooperate, and mobility. I'm also going to assess the patient's knowledge and any prior experience to catheterizations and their feelings about the procedure. And then I'm going to perform hand hygiene, apply gloves.
Is that my catheter?
Yeah.
Here's another thing. I think that I'm gonna have my
At this time, I'm going to palpate the bladder.
because when you're trying to reach over.
If there's a bladder scanner available, I would use that.
If it's right here, now you're going over the damn.
Then I'm going to remove my gloves, perform hand hygiene. At this time, I would go get my supplies, which I have, and get another nursing personnel to help assist if necessary. And then I'm going to explain the procedure. Hi, so I'm here to cath you, and then I'm going to perform hand hygiene, apply gloves. I'm going to make sure that I provide privacy, that the bed is at a working level, that the side rail opposite of me is up, and the side of the bed that I'm going to be standing on, the side rail would be down. Now I'm going to drape the patient. And of course, I already said it, but perform hand hygiene before I put gloves on.
After initial leaders for us, put the catheter on the natural tooth method. And then don't put in the side rails, put on the side. And if there's no obstruction in the flow, yeah, if I do something like that or something that I broke, so I don't get.
I wasn't even looking at you, I was just doing my own thing.
If, like, when I'm opening this and I break still, you could, like, right before I should have opened and just the collapse, you could stop it and just re-fold it. So let me know, I'll know what it is.
I'm gonna read mine as I go, because mine's a lot more broke down than 3 pages.
Yeah, just,
That way I have to
you
jump
can,
ahead.
I want you to know, so if I miss something, I'll know the points.
Yeah.
So now that I got the patient in the recumbent position and draped properly,
So we know, we can look at the point from there.
I would illuminate a light on the genitals so I can easily identify the urinary meatus, which is right there. And if needed, I'd have my assistant help me shine the light or hold the light on the genitalias. At this time, I would do perineal care, washing with soap and water, rinsing with water, and patting dry. I'm going to identify the perineal area for any anatomical landmarks, erythema, drainage or discharge, and or like discoloration and odors. And then I'm going to remove my gloves and perform hand hygiene.
We want to also access the patient's age, gender,
And at this time,
their
I'm going to start opening my kit.
also you want to know the patient's comfort level for the patient. Then we're going to perform hand hygiene. We're going to put on gloves. We're going to come into the room. After name, date of birth, looking at their name tag, raise the gun up to right at the level, and we'll do that. Then we're going to ask the patient if they have any allergies, and we're going to assess the patient's weight, cognitive level, how much their mental health, and also their mobility. And we're also going to ask the patient if they've ever had catheters before, and if so, if they have any feelings about the procedure, or if they apply gloves and perform hand hygiene.
So, at this point, just for precautions, I would perform hand hygiene.
Palpate the patient's bladder or the symptoms of fetus. So, feeling everything feels good. Then we can also use a bladder scanner. If that's what we're going to take off our gloves, we're going to reapply or wash our hands, perform hand hygiene, and then we're going to reapply new gloves if necessary. So, once all that's said and done, we're going to get all our supplies ready, which I have in here. We're going to then get extra personnel if necessary, like nursing personnel. And I'm going to explain the procedure to the patient. So we're going to give you a catheter because you have too much urine that's not coming out. So after that, then we're going to perform privacy. I'm going to provide privacy. And then I'm going to perform hand hygiene and apply gloves. I don't need to apply gloves. And then what I'm going to, I will apply gloves. So apply the gloves, raise my bed up, make sure the rail is down or up on the side up, not working.
I'm going to make note that 1 inch around my border is unsterile. Going to come in and get those out.
Alright, so we're going to start with cleaning the back sink oven. And out. There's the clean down.
Keeping my vision, or my sterile field in vision. When I put that under, I'm going to ask the patient to raise their hips, if possible. And then I'm going to take this out
I'm going to position the patient and look at their
and put on gloves.
Alright, so now that's all good. I'm going to take my mask off and perform some hygiene. before I take my gloves off, I'm gonna illuminate my genitals, get extra help if necessary. I'm gonna provide care to them, rinse, wash, rinse, and dry. And I want to also check for any erythema, drainage, odor, that could be present. Then I want to take my gloves off, apply hand hygiene, and then that. So now that's done, I'm gonna open my kit. Don't need those. Alright, so. Alright, so to begin, I'm going to open this up. Be very careful not to. So I'm going to leave that to this side. Nothing bad happens there. Okay, so I'm going to come around and take these gloves out.
Going to dip it in the gel.
Then I'm going to come on here and get this out. So I'm going to put the shiny side down. And I want to always be keeping an eye on my catheter.
Okay.
Keeping my eye on my catheter at all times. So once that's good, I can
So this is my non-dominant hand now. I'm going to spread the labia.
take that out. You don't need this either.
I'm going to clean the labia farthest away from me first. And then the labia fold closest to me. And then right down the center. Making sure that it doesn't touch anywhere but like directly in the hole, and same with my fingers. I would insert it until urine, I started seeing urine. When I seen urine, I'd insert it just a little bit more. Clamp it there with that hand.
So to begin the procedure, I'm gonna come out. Want to be careful of this. Pull it back. So I want to open just like the corner of it.
This time I'm going to pull this out just a little until it met resistance, and then insert it just a little bit more so it's off the bladder wall. Going to grab all my stuff and take care of it.
I'm gonna
this time, I'm just gonna remove my gloves and perform hand hygiene.
Open this.
And then I'm going to put new gloves on. I want to coil the excess tubing up and then clip that on the bed. I want to note that I would not hang the bag on the railing or let it hang on the floor. I would provide any hygiene to the area right now if needed, and make sure like everything is flowing through the tubes just fine. And I would measure initial urine and record. This time I'm going to remove my gloves and perform hand hygiene. I'm going to get the patient in a comfortable position. I would put this in the proper receptacle and take care of it. Making sure that I brought the bed back to a low level, and like the lowest level, gave the patient their call light, and replaced the side rails if they were used.
I got some drips on the catheter.
And then
I would have to get some
I would perform hand hygiene again and put new gloves on. I would palpate the bladder one more time for distension. And then I would ask the patient their level of comfort. I would observe the character and amount of urine in the drainage system, and I would note the character and amount in the drainage system, and I'm having a brain fart, hold on. I would, who's at the tip of my tongue?
Now I can grab my box.
I would, so catheter, tubing, make sure it's there and all, has patient level of comfort, make sure that the catheter, character and amount of catheter, and I would lower the bed, give the patient a call light, patient's level of comfort, and obviously I document, but I have to go and physically do that, the documentation when I'm done. And then I'd make sure that there was no leaking in the catheter and the tubing. Sorry, that took a minute. Yeah, check for any leaking, and yeah, that's all.